Now we will discuss on different types of environmental hazards and principle of risk analysis. Environmental hazards arise from both natural and anthropogenic sources. There are different types of environmental hazard. The first one is biological hazards. For example, bacteria, viruses, and parasites is a biological hazard. And then chemical hazards. Chemical hazard includes toxic metals, air pollutants, and solvent. Physical hazard can include noise, vibration, and exposure to extreme temperatures. Mechanical hazards include motor vehicle, sports, home, agriculture, and workplace. And last but not least, psychosocial hazard include stress, marginalization, and lifestyle disruptions. In order to identify and manage the environmental hazard, we need to conduct risk analysis. We will start our risk analysis with risk assessment, then the risk communication, and finally the risk management. Okay, what is risk assessment? Risk assessment is the process of analyzing the possible effect on people of exposure to substances and other potential hazards. And then exchange of risk information among all stakeholders on how much is the risk and how to manage. It was done during risk communication. And then in risk management, we will develop, evaluate, and implement the regulatory option and aim at the risk reduction and control. So how do we conduct risk assessment? First, we need to perform hazard identification. What are the health effects that this agent can cause? Then we go to dose response assessment. This will look into the relationship between dose and occurrence of health effect in human beings. We will then investigate the exposure. We will look into exposure that are currently experienced or anticipated under different conditions. And finally, we will conduct risk characterization based on the risk metric itself. And this will estimate the occurrence of adverse effect in the given population. This risk analysis principle can be used in different types of events such as global warming, greenhouse effect, and also in a new emerging diseases. We discuss on global warming. It is estimated that by 2030, the average global temperature will have risen between 0.7 to 2.0 degrees Celsius. This will raise the average level of the seas due to the world's ocean expanding as they warm and possible melting of the edge of the polar ice caps, creating a substantial risk of low-lying areas and even entire countries being completely and permanently flooded in many areas. Climatic changes will have a dramatic impact on biodiversity in different areas, and crops could be damaged by climate change. Drought frequently will increase in Africa and part of Asia. Rainfall increased by 1% per decade in Northern Hemisphere, mostly are due to human activities such as forest fires, transport of coal, natural gas and oil, agriculture, and industrial activities. Okay, what is greenhouse effect? Carbon dioxide, methane, chlorofluorocarbon, ground level ozone, and nitrogen oxide are the greenhouse gases. Accumulation of these gases in our atmosphere will increase the re-emitted heat, and less heat will escape into space. Carbon dioxide produced by vehicle and burning of fossil fuel, while methane produced by bacteria from rubbish, burning of fossil fuel, and decay of organic materials. Chlorofluorocarbon released from aerosol, refrigerators, air conditioners, and insecticides. And nitrogen oxide from the fertilizer, burning of fossil fuel, and human and animal waste. Formation of ground level ozone occurs when sunlight reacts with this hydrocarbon and also the nitrogen oxide. Okay, now we go to new emerging diseases. They are the global threat in our countries. Infectious diseases remain the leading cause of death in the world, killing more people than heart diseases or cancer. WHO reports that some 17.7 million people die every year of infectious diseases. Modern transportation has increased the probability of vectors and non-human carriers of disease being introduced into areas where they did not exist before. The Asian tiger mosquito, the Aedes albopictus, which is the vector for dengue fever virus and other viruses, was recently introduced into the United States in mosquito eggs deposited in the shipment of rubber tires from vehicle from Asia. New variants of cholera germ Vibrio cholera 0139, which is more toxic and now present in at least 10 Asian nations. In Malaysia, in 1999, the Nipah virus led to the death of over 1 million pigs. Over 100 people succumbed to the disease, resulting in disabilities and death. Severe acute respiratory syndrome, or SARS outbreak, which had killed more than 800 people, infected nearly 8,500 in some 32 countries, and also crippled economy in those areas. In 1997, the H5N1 avian virus, which causes bird flu, infected 18 people and killed 6 in Hong Kong, and later it spread to Europe and 11 Asian countries in 2004. Now it is a major threat in the new millennium, spreading from country to country. The outbreak of influenza A H1N1 virus to human beings, which started from Mexico, is spreading worldwide with casualties. This concludes the second part of this lecture, which understanding the environmental hazards, principle of risk analysis, and global threat to the world.